Hey Farmies, we're going to start out by talking about anticoagulation. So our anticoagulation meds are going to be heparin, which works by preventing thrombi from forming. So it prevents the conversion of prothrombin to thrombin. So this is something that helps prevent clots. Warfarin is another med for us. Warfarin works by interfering with the synthesis of vitamin K dependent factors. We give both of those to our patients who have AFib or other risks for clotting. Then we have clopidogrel, which is an antiplatelet medication. So clopidogrel works by inhibiting the ability of platelets to stick together. That's what aggregation means. So we give this to our patients who are have had a stent placed. Another antiplatelet medication is aspirin. So I made a little chart for you guys to help you remember these. Of course, you have to remember our non-pharm options, right? SCDs, TEDHOs, exercise, etc. But for our anticoagulants, one thing that we should always think about is what do they have in common? And so for these, the thing that they have in common is bleeding precautions. So keep in mind what you tell your patients who are on bleeding precautions. So they don't want to use a razor, right? They want to use an electric shaver instead. You don't want to use a hard bristled toothbrush. You want to use a soft bristled toothbrush. All of those type of things. So just, those from fundamentals. So keep in mind all of the things that you think about when you think about bleeding precautions, because those apply to all of these meds. So I gave you these little triangles of color for our different groups of medications. So heparin and enoxaparin are our two heparin products. Enoxaparin is just low molecular weight heparin. We measure this using the PTT. And I like to remember this by doing a little P in front of my heparin and cross the two tops of the H's. So that reminds me that it's the PTT because with warfarin, it's just the PTINR. So that helps me remember that it's PTT that we're measuring. The antidote for heparin is protamine sulfate. And then enoxaparin, I drew a little injection syringe for you because we give enoxaparin. It comes in these pre-filled syringes. It's called Lovenox. Has a little bubble that you leave in because it keeps the medication from migrating back out the needle track. So heparin, you'll measure it with a protocol in the hospital. It's given IV, and it can be rapidly reversed with protamine sulfate. Next one. So let's do this. Let's cover heparin over here. There's heparin. Now let's look at warfarin. So warfarin is measured with the PTINR. It's given in a pill form. And we have to remember that the antidote for warfarin is vitamin K. It works by inhibiting the synthesis of vitamin K. So here's our warfarin. We are interfering with the hepatic synthesis of vitamin K dependent clotting factors. So vitamin K is found in green leafy vegetables. So our patients can have those. We don't want to stop them from having them, but they just need to have them on a regular, stable amount. You don't want to start eating a whole bunch of them and all of a sudden, and you don't want to stop eating them very quickly because it's going to change your warfarin levels. So just think about vitamin K it's in those green leafy vegetables, and that helps you remember that vitamin K is also the antidote for warfarin. So we measure our patients' warfarin levels with the PTINR. Finally, so there's warfarin. I'll put that one up. Finally, we have clopidogrel. So clopidogrel is Plavix. So patients who have had a stent, I drew a stent for you here, take Plavix. So after you have a stent placed in your coronary arteries, your body sees that as foreign and it tries to make a little scab on there. So all the little platelets try to come and stick to it. And if that happens, if we let that happen, it's going to make another blockage of our coronary artery. So that is obviously going to give us a heart attack. So we don't want that. So we take an antiplatelet medication so that this doesn't happen. Our stent stays open, blood flow is clear. So we give it to the patients with a stent, and they can't stop taking it, because if we stop taking it, as soon as you stop taking it, the platelets come back and start to stick together again. So don't stop taking it unless you have surgery. So if you are going to have surgery, you have to stop these medications. And for clopidogrel, you have to stop it 5 to 7 days before surgery. So another antiplatelet, just to kind of throw that into the mix, we've already covered it in the past, is aspirin. So made it purple, just like clopidogrel, because they're both antiplatelet medications. And we want our patients to stop that before surgery. All right, so there you have clopidogrel as well. And then just show you a little card for enoxaparin. Enoxaparin is also called Lovenox. And I'll just put that out there in case you guys would like to have a look at that. We give this to prevent DVTs after surgery. And so, like I said, that is given by injection. There are things to know about that, but we'll talk about that another time. And then finally, protamine sulfate. I have a little card for that. This is the antidote, remember, for heparin. I thought I'd show that to you, but I hope this little chart kind of helps you keep them straight. So heparin, PTT, protamine sulfate, warfarin, PTINR, vitamin K, clopidogrel for stents. Do not stop taking it unless you're having surgery. All right, guys, have a great day.